All right, guys, in today's video, we're going to be discussing the things that the surgeons don't tell you about the surgery rehab process. Now, before I get started, this is a disclaimer. This is not medical advice of any sort of kind. This is just me speaking from personal experience, as I'm an athlete who has had 7 knee surgeries and has been able to fully recover from them multiple times. So, yeah, like I said, a little bit about myself. I've had 7 knee surgeries, and I've been able to fully recover from them and return to sports multiple times, even when I had the surgeon tell me to my face that I'd never be able to play sports again. I'd never be able to run again, let alone walk. They told me I'd be crippled by the time I'm like 30 and not be able to like walk upstairs, which is ridiculous. But we're going to get into the things that the surgeons don't actually tell you that you need to know. So, the number one most important thing to speed up your recovery process is going to be sleep and diet or nutrition. Now, for sleep, you need to be sleeping a minimum of 8 to 10 hours every single night. Well, not a minimum of 10 hours, but you get the point, right? Now, how we can optimize this is by setting our circadian rhythm properly through getting enough proper natural sunlight and avoiding blue light after sunset. And now for diet, this is what surgeons actually have no idea what they're talking about. It's amazing to me how all the surgeries I've had, these surgeons have absolutely no clue about nutrition because they just don't learn it. And it's crazy. Like a lot of the surgeries I get, the first thing they offer me, they're like, oh, maybe your stomach's going to be upset from all the drugs we gave you. So here, have some crackers. Like, are you kidding me? Crackers? Some processed little crackers. You think that's going to help me with my recovery? So that's what you got to understand with diet. Just avoid all processed inflammatory foods like the crackers that they were going to give me. And instead, prioritize real whole foods, mainly animal fats and animal proteins, because these will give you all of the essential building blocks that you need to stimulate tissue repair and bone repair. You get the point. And also, avoiding processed food will reduce the inflammation, which will allow your body to actually have the right environment to start to heal. Going on to the next tip, it's going to be medication. So it's actually insane how these surgeons are able to get away with just prescribing a ton of drugs to you. Like my most recent surgery, it was a very minor little like cleanup, and they prescribed me a whole laundry list of drugs. And I was like, are you kidding me? Like, and newsflash, I didn't end up taking a single one, even though they kind of fearmonger you into taking all of them, which is ridiculous for someone who's never had a surgery before. Now, again, this is just my personal experience, not medical advice. Obviously, listen to your medical professional, but here's why these are, not the best. Why I didn't personally take them. Now, starting with non-steroidal anti-inflammatories. Now, I've been prescribed to take these like long term. Like my surgeon was like, "Oh, you need to be taking these, every few days or every day even, shoot, for like months on end." And I'm like, "Are you serious? Like that is the dumbest thing ever because these clearly cause organ damage over time and will give you like ulcers and other problems. They basically just cook your organs from the inside out, like any sort of drug really does." Now, the next one, this may seem minor, but like Tylenol, they give you some Tylenol or some ibuprofen for your pain. Just man up. All right. You don't need that. You don't need that stuff. It's not going to help you. Tylenol literally is going to give your offspring autism. So if you want to take that chance, go ahead. But yeah, this is not good. You do not need this. Now, this is the more serious thing is oxycodone and these opioids that they prescribe you for painkillers. Now, this is super irresponsible for them to prescribe you this. Like my first surgery, it was a pretty minor surgery that they did. And I was only like probably like 16 years old. And they gave me this whole jug of oxycodone. It was like literally this big. And that was just insane to me because like how was I gonna use all those pills? How do they expect me to go through that entire bottle? I mean, do they just want me to get addicted? Like these are the most highly addictive opioids out there. Like these are where you hear all those stories about people they have those injuries and then like they get addicted to these painkillers and then they overdose. Yeah, so it's like they literally want you to overdose by giving you a whole like freaking water bottle size of oxycodone. Absolutely ridiculous. Now, another thing they may offer you is nerve blocks. So don't get the nerve block. This is literally just poison that you're injecting into your bloodstream. I actually had the nerve block one time, even though I said I did not want the nerve block. They gave it to me anyway. So, I mean, there's probably some sort of, you know, lawsuit I could have there. But yeah, this nerve block thing, it didn't even help me. It actually made my pain worse because it like made my nerves like hypersensitive after. And it was really weird because they literally just inject poison into your bloodstream. So do not take this. You do not need this. Decline it, even though they're going to pressure you and be like, well, all of our patients get this for this procedure. It's a pretty serious procedure. No, no, no. You'll be fine. Just man up, toughen up. You'll be all right. And now the last drug they prescribed me for my most recent surgery, which they're probably going to give you, is blood thinners. This is pretty standard. And they say that, well, this is to prevent blood clots. But I feel like this risk of blood clots is kind of overblown. Like maybe for your average person, like it's kind of to idiot proof the surgery. Like if you're just insanely unhealthy and you're just sitting on the couch all day, not even making an effort to rehab, then yeah, you might run into some problems with blood clots. Or if you already had like not very good blood flow from, just not being healthy. But if you're healthy and you actually care about your recovery, you do not need to take these blood thinners. But you know, listen to my advice at your own risk, right? Because they like to fearmonger you, tell you that you're going to get a blood clot otherwise. But I haven't had any problems. This is just my experience, right? Not medical advice of any kind. Now, moving on. Now, this is going to be getting back to intense exercise. So a lot of the surgeons, they're going to be telling you that, oh, you need to stay away from high intensity exercise. Or, I mean, they literally told me that right now that I should not be doing any sort of high impact with my condition. And it's very irresponsible. But I literally just squatted 200 kilograms the other day. Um, so yeah. But actually lifting these heavy weights, it may sound dumb to you, but it's what it's allowed me to actually recover because it gives my body that stimulus to actually adapt. Um, and yeah, that's what you need because every time you lift weights or exercise, you're making these little micro fractures in your bones, and then your bones will recover and they'll actually get stronger. So like with my instance, I had a bone and cartilage problem, and when I would do this, it would actually help strengthen my bone and cartilage. So obviously you want to be like take it easy, right? Like, but the thing about getting back to exercise is they're gonna give you like this almost like religious doctrine of like this is the timeline that you'll have. But just listen to yourself. Just do stuff as tolerated, always as tolerated. Like once your incisions heal up, you're pretty much fine to just do anything as tolerated. This is like with any surgery you have. I mean, there's some instances if you have like a really insane surgery, like how I did when I had this whole like allograft replacement, where like yeah, maybe you don't want to weight bear uh, for a period of time. But for most of you out there, you want to be trying to rehab as tolerated, and this may require you to get a little bit uncomfortable and push yourself. And you need to be able to overcome these limiting beliefs that you may have about like getting back to, like maybe full body back squats or like sprinting, and just kind of build up to it slowly. Like I'm not just saying jump right into it, but I'm saying don't be afraid to get back to this, to get back to baseline where you were before. You're gonna need to push yourself a little bit. You shouldn't be pushing through sharp pain, but yeah, be aggressive with your rehab. Yeah. Now, moving on, this is probably the most important part. It's the mental side. This is what they're not going to tell you at all. Obviously, this is going to test your mental toughness for sure. Any surgery you have, it's going to test your mental toughness, and you just have to, take it one day at a time. And, it's not going to be a perfectly linear recovery. There's going to be some days where you don't feel as good. And you're just going to have to take it one day at a time and, try to win the day. Do whatever you can that one day, and you'll slowly get better over time, even if it may seem like, you're stagnating at some points. But just, yeah, understand that you will heal. And the reason why the mental side is such a big emphasis is because if you don't give your body the right environment to heal, it's not going to heal. Like that's how powerful your mind is. But if you trust that you'll be able to heal, then you'll heal because a lot of pain, it just comes from your brain. It's not actually a real thing. Like there's plenty of science out there about like the mind connection with pain, and how a lot of it can be solved just by strengthening your mind. So this is arguably the most important part. But yeah, these are just some things that surgeons don't tell you. So just to recap, sleep and diet should be your number one priority. I mean, you're not going to have a good chance at healing if you don't address these. Um, don't take as little as prescriptions as possible. Okay, that is my best advice. All right, obviously, you know, speak follow your medical provider. Right, don't sue me, but yeah, try to avoid as many medications as you can because they're all poison. Be aggressive with your recovery timeline, but listen to your body, right? Let's be smart, and you gotta be mentally tough, right? And yeah, just keep going. You got this. Take it one day at a time. If you need any further guidance or questions, you can apply for my one-on-one custom coaching. I offer free consultations with the link in the description, so we can talk and see if we'd be a right fit to work together. That's about it. I hope this helped you guys in some way, and I'll see you.